Hey guys, I am super excited to bring you this episode. It features some folks who I think are just so cool, and that is Dr. Michelle Oakley, aka the Yukon Vet, and her daughter Sierra, who were gracious enough to join me all the way from Australia. So, despite some very real logistical challenges, we managed to pull this off. First off, if anyone is wondering, the time difference between Eastern Standard Time and Perth, Australia is, well, now it's 12 hours since we sprung forward, but at the time, I think it was 13 hours. I honestly don't know. Australia is now part of the world clock on my phone, and I still struggle to figure it out. Anyhow, also, because of the time difference, I was recording from home rather than from the VetFolio offices, and we had no idea if my internet was going to hold up. I just graduated from relying on my phone's hotspot for internet for the last 4 years to Starlink out here in the sticks. It's so exciting to have actual internet, but it's not full service internet yet. I'm kind of deprioritized. So we had no idea what we were going to get. But I'm happy to report, despite a couple little blips that seem to be limited to brief interruptions on my end, I do think we managed to get some pretty good audio quality, but please do bear with us if you hear a little bit of lagging here and there. We were half a world apart. In spite of all of these challenges, though, we made it happen, and I want to say a huge thank you to the VetFolio team for helping to pull this off, and thank you to Dr. Oakley and Sierra. Let me tell you, they're just as cool in person as they are on the show, and I can't wait to bring you our talk. An Indiana native, Dr. Michelle Oakley earned her undergraduate degree in zoology from the University of Michigan. While studying there, she took her first trip to the Yukon as a field assistant on an Arctic ground squirrel ecology study. During that trip, the Yukon became home. She graduated from Atlantic Veterinary College in 2000 with a doctorate in veterinary medicine, and shortly after that worked for 9 years as the wildlife veterinarian and regional biologist for Yukon's Fish and Wildlife Department. Dr. Oakley also interned at the Calgary Zoo, where she regularly returns to provide relief services. Dr. Oakley runs her own mixed animal practice throughout northern Canada and Alaska, often with the help of her 3 daughters, Sierra, Maya, and Willow, who also appear regularly on the TV show The Yukon Vet. She also works as an on-call vet for the Yukon Wildlife Preserve, the Alaska Wildlife Conservation Center, and the American Bald Eagle Foundation. She runs specialized wildlife capture and conservation programs throughout Canada and also in Scandinavia, Sri Lanka, and Europe, which we talk a little bit about on the podcast. All right, let's jump in. Well, I'm super excited for this episode because despite some geographical and technological challenges, we're half a world apart. They're in Australia, where it's Saturday. I'm in Florida, where it's Friday. And we somehow managed to pull it together and bring the Yukon Vet herself on the show, Dr. Michelle Oakley and her daughter Sierra. Thank you guys so much for joining me.
Yeah, thanks for making this work. It's Saturday in Australia, and I know it's Friday for you. So
thanks for having us.
Absolutely, super excited. And let me tell you, I'm very happy to have finally made it to Friday evening. So I think one thing that, we're all dying to know is the Yukon Vet. I know for me, I really enjoy the show. My kids love it. I love watching it with my kids because I think it gives them a lot of insight into some of what it's like to be a veterinarian. How did all of that come together? How did they find you? How did all of this get started?
Oh, thanks for saying that. That's actually one of the most important things about the show to me is that it's such a good family show. And so many people write in and say they watch it with their kids or their grandkids or their kids drag them in to watch it. So that's awesome. And how did they find me?
I'm pretty sure it was like they sent out some mass call, right. And then you ignored it. And then I think Carla sent it to you.
Yeah.
And then you ignored it again. And then she was like, I think you'd really be good at it.
Yeah.
And then you finally applied. And then we got,
that's right.
We had somebody come up and make a sizzle. And that was still to this day, one of my favorite, funniest memories, because we were at the wildlife preserve and I forgot the stethoscope when we were going in the field.
Oh, poor baby. I remember that. You were so sad. Yeah. Gosh, you have a good memory. See, Sierra not only looks after all of the details when she's like been my, right-hand woman, mini me, tech extraordinaire in all of this work for years. We started when you were 14, I think, started filming the show.
Yeah.
And now Sierra's 25 and I'm actually in Australia because we're here to deliver her to Murdoch University. She's starting her first year of vet school. So, but back to that. Yeah. My Carla Fury Anderson, who's a vet in Newfoundland, actually is my best friend from vet school. And she was like, you got to do this. You got to do this. And at the time I was a wildlife vet for Yukon government, and, it was really busy. And I was also then transitioning to, leave government and do a mixed practice where I did a lot of the wildlife work still on contract, but then was trying to set up a brand new kind of mobile vet service, which was really difficult and really expensive in such a remote place. So then the show kind of, hit me up a couple more times and I was like, okay, let's do this. We'll film for food at this point because it was hard to make a business work.
So also, if we can kind of go back to that a little bit, that you were a wildlife vet for the Yukon government, but you're not originally from the Yukon, right? You're a fellow Midwesterner.
Yeah, I'm originally from Indiana. I went to University of Michigan for my undergrad in zoology, and they had a really cool wildlife study going on in the Yukon, and ended up going there, just fell in love with the place, and it just became home for me. I met my husband there, where now we dissolved our marriage, unfortunately, but he's a great guy. I love the Yukon. We raised 3 wonderful children there, and so the Yukon was a really good starting place for me, because when I went to the Yukon for the wildlife study, I ended up staying and then ended up going to vet school from the Yukon, became a dual citizen, became Canadian, and then ended up having, my 3 daughters there, and kind of the rest is history, I think.
A documented history.
Yeah, that's what I say to Sierra. I'm like, I think I'm off the hook for scrapbooking because, your childhood has been on camera.
Mm-hmm.
So yes, I mean, you seem very at home in the Yukon, and you were talking originally about about how it was very expensive to start a mobile practice because of some of the logistical problems that you were running into and things being very remote. Can you talk a little bit more about that? I know I've seen on the show where, you're unloading snowmobiles to go somewhere, or, taking really long ferry rides. What are some of the logistics like?
Yeah, the logistics of, getting a vet practice around the Yukon and Alaska, probably the majority of my work is done in Alaska now, which is right across the border, but we go to both places. It's crazy. I mean, the town that we're in right now is Haines, Alaska, and that, you can drive to it from the Yukon, but the nearest big city is about a 5-hour drive through a mountain pass, and that's to Whitehorse, Yukon, which is only about 30,000 people. So it's not a huge city. And then from there, if you try to get to any of the bigger Alaskan cities, you have to take a ferry, which is maybe once or twice a week and maybe only once every 2 weeks in the winter. Or we have these little seaplane flights that go a couple of times a day, but they're, in the winter, they're canceled probably a third of the time. So it's incredibly challenging, not only for us to get around, but also for people to get their animal vet care. So, when I'm in Haines, I run a clinic periodically, but then we travel out to all these remote communities. And yeah, we've gone by boat where we charter some of the different passenger boats or whatever. I have a Sea-Doo. I've gone by Sea-Doo to do emergency calls in some of the nearby communities, and that's always fun. We often travel to Girdwood, which is south of Anchorage, and that's where the Alaska Wildlife Conservation Center is. And I'm the head vet there. I'm actually the only vet, but I love that they call me the head vet. But yeah, so then I travel there on a regular commercial jet to Anchorage and then have an hour drive. So, I mean, really a lot of our time is traveling. And I think the show, that's one thing we always talk about that we need to cover more in the show, because it just looks like we're just driving everywhere. We just kind of show up. But man, the travel is so challenging. We took this summer, actually, I'm really excited for people to see the new season, because what's coming up is one of the boat trips that we do where we charter a boat and we go down and we visit a bunch of different little communities in Southeast Alaska that are either on islands or there's no road to them. And that is super fun because these people never get vet care. Like, vets just don't come there. And so when we show up with this like makeshift clinic, they open up the fire hall for us, or they open up the gym, and we set up and do all the spay neuters we can. And we see all the emergencies that have been waiting, and all the, chronic gnarly conditions that, people couldn't get to a vet. And it's amazing because these people depend on their animals just like we all do, not only for emotional support, not only for companionship, to get them out and moving, but also to tell them there's bears right there, or to tell them,
Sure.
there are a ton of big brown bears in these areas where, they're not trying to get people, but if you bump into them and startle them, you will be attacked, so it really, your dog tells you so far ahead of time that there's, a danger in the area. So it's just really cool to be able to ensure that people have their companions, that are healthy, and they're trying so hard to get them the care they need, but there's just no way they can afford it in most cases.
Mm-hmm. Yeah. And like whenever we show up at these like tiny communities and stuff, like we bring our entire clinic in totes. It has taken quite a few years to master, and we're honestly not even there yet, but it has gotten pretty good where we basically just fill up different totes with like surgery, exam, lab stuff, and we just memorize where everything is.
Well, you do. I just asked you,
Wow.
where's the laryngoscope? And you're like, that's in surgery tote.
I'm like, actually, it's sitting out right in front of you.
Yes.
That's usually where things are when I can't find them. They're like, you're literally touching it. I'm like, oh yes, that makes sense.
My favorite tote is the miscellaneous tote. That's where I put everything. And Sierra's like, that's not where it goes, Mom. It actually goes. That's a surgery pack that goes in surgery tote. I'm like, oh, I thought it was miscellaneous.
It's like the junk drawer of the tote.
But yeah, we go to these communities with like 20 totes, right? Like I think we counted it up. It takes like around 20 totes of ours to just get our vet clinic into. And that is loading on and off planes. That's loading like on and off the dock. Oh my gosh. Like every small community we went to, we had to load everything onto the dock and then either truck it up the ramp ourselves to get it loaded into a car to go to the gym or the fire hall or wherever, or use somebody's four-wheeler and just
usually
make
four-wheelers.
So many trips. And like, I mean, we have a lot of gear. We have like around 20 totes, but the film crew, they have like another 80. Yeah.
So we're at a dawn show when we show up at the airport.
It is a lot to see our group photos with the mountain of stuff behind us. It's so funny just to see how much goes into what we do there.
Yeah.
That is unbelievable. Like that, I mean, like you guys are working hard to go and make all of this happen. How often are you able to do these kind of clinics? Like how often are you able to go back to the same place? I'm thinking of these islands that you're describing where, some of these gnarly conditions that may have gone for a while without treatment. Are you able to get in there and do much follow-up, or is it like, I'm going to do everything I can for you right now and give you the best advice and here we go?
Right. It's definitely not like, okay, we just did this surgery and we'll see you in 2 weeks to remove sutures. No, like you have to work with the owners on, suture removal and follow up. And often these communities have one person who's like, the one that really looks out for everybody's animals. And they're always our most important contact because they help us with the follow up. Sometimes they have like a little mini shelter, but not usually. It's usually just one person, one kind person who's going around helping everyone. So they become our liaison. We do a ton of like, telemedicine where we're on the phone with them talking later. And I mean, some communities we never get back to, and that's kind of heartbreaking, but some it's, kind of it's become an annual thing. And, Haines, I live in Haines, but that's a small community as well. That's only, about 2,500 people. It's not enough to support a full-time clinic. And I'm traveling all over anyway. So, even in Haines, the town where I live, it's just kind of like once a month that I'm doing a clinic there. So it's really tough for people. And I find that is one of the hardest things that I deal with is the guilt of not being there for people. It's like, of course I know logically I can't be there, but it seems like no matter where I go, the place I left, there was an emergency where, someone really needed help. And it's just, gosh, I find that hard, to be spread so thin and not be able to, it's just that feeling of God, as soon as I walk out the door, I know something's going to happen, but what can you do except try to be there?
I mean, you're weighing out like how much good you're doing with you just can't be the only, as one person you can't be there for all of these animals all the time. And,
Right. Yeah.
but amazing for doing all of the work that you do. I mean, 20 totes for the clinic, 80 totes for the film crew, which we talked about this a little bit before, that, the film crew is really kind of a necessary component of these clinics.
Yeah. I mean, it is a reality TV show, and I'm proud to say it's not scripted. They don't tell me things to say. They don't come up with stuff for me to do. I mean, this is really what we do. But the one thing that I guess probably isn't, talked about in the show is that I couldn't afford to do this without the show. And I think anyone who runs a vet clinic knows that, the cost of a mobile practice is so expensive. We'd all love to go around and provide, free vet clinics all over,
Right.
wouldn't we? It's such a great feeling. It's so nice to be able to do it. Most groups that are doing it on foundations, donations, organizations, things like that support that. But in this case, it's Nat Geo, and it's pretty awesome that they're, able to do it. They cover my overhead, essentially, the travel overhead, not the clinic, but, they cover getting us all over, they feed us, they have a place, help us get places to stay. Although in some of these communities, we're staying in people's houses and stuff, but
yeah, sure.
But in general, when we're traveling in hotel rooms, I mean, that's all so expensive. And the sad reality is that none of these towns, not even the town I live in, have the population base that's high enough to, support a real clinic, a full time. And I mean, I know there's a lot of sole practitioners out there, but man, even that is a tough life. I mean, one vet, one or two staff people, maybe a tech or something. I mean, it's so hard, from my understanding, to make that work as a business, because you really need 2 or 3 vets to get enough income in to pay for everybody. And, as one vet, you're on call 24/7. So I mean, that is one thing that I warn people about, because a lot of people reach out, a lot of, new grads, and they're like, oh, that's what I want to do. I want to go live in a rural place and be this vet that travels around. It's like, yeah, me too. But that is the only unreal thing about our reality show, is that I don't know that, all creatures, good and small, kind of a lifestyle exists out there anymore, is financially feasible anymore, and
I'm glad to hear you talk about that, because I think that's a really important thing to address, that, you do have to have a certain level of income, and there's so many factors that play into being able to generate that. And, we can romanticize it all we want, but there's a financial component to it. And, even if that is, the way that it's portrayed on the show maybe doesn't come across that it's the show that's making this possible, to hear it, like, I love hearing about it, because I'm going, wow, not only are you bringing a lot of what veterinarians do to the general public, and in my opinion, I think really showing a good example of, practicing good medicine, working with what you have to get the job done, but because of the show, now able to do that for communities who otherwise, you may only go one time, you may only go once a year, but if it weren't for that, it might be nothing.
Yeah. I mean, and I just love Nat Geo for that. I mean, not only they're helping us like inspire kids, we get like the cutest fan mail all the time, and letters from parents too, that are so excited their kids now want to be vets, or, but they're also letting us like Robin Hood around, these remote places. And it's just like, I just can't thank them enough. All the animals they help. Well, yeah, they're making a TV show. I know they have their motives too, but it's, every time someone's like, oh, you did this, I'm like, yeah, well, thank, Nat Geo, who's helping us get around to do this. It's just, we're really lucky. And, now that we've kind of built this platform, we know the show won't last forever. You're lucky if you get a few seasons, and now we just filmed season 11 and 12. So, it's been an awesome run, but I don't know how long it'll last. And so now, like, my last year or two has been just this focus on, how can I build a foundation to keep this going? We can't expect Nat Geo to be a sugar daddy forever. So, and then we had a really cool experience a few years ago when the bushfires happened and in Australia, and that was actually covered on the show, when we had just learned about treating a severely burned dog. Unbelievably, is like over 40% of his body was burned. He had been tied to a house that burned to the ground. outside. He was outside and somehow he survived. And when the firemen came and cut him loose, he was on fire. He ran away on fire and ran down to the ocean and went in. And so that story was so incredible with how the people wanted to treat him. And then, I was ready to give up on him, to be honest. And a tech that I knew was like, isn't there someone that does like this fish skin? And then we ended up reaching out to a woman named Dr. Jamie Payton, who's just a saint. She does all this fish skin work, research, where he puts fish skin on all types of animals that have burns. And it's incredible how much faster the healing process is with fish skin. And, long story short, or long story longer, I don't know. We learned that technique and it was really good. Then like the bushfires happened and we're like, this is a really cool technique we'd love to share. And so we, pulled Jamie in and we did a GoFundMe and we got a ton of money donated because people knew the show. And then we took all that money and we went to Australia and we shared this technology and some of the actual fish skin with a bunch of different vets there. And so we were treating koalas and, a bunch of kangaroos and wombats and, all these animals, that it just made their it instantly stops the most of the pain for a lot of the burns. And then it just allows like a scaffold for healing that's so much faster. It's weeks instead of months and months for the skin to grow back over. And so anyway, that was just such a cool process to go through. And then to see also, not only just with the fish skin, but to see the potential out there to help, even if we don't have Disney. Well, I feel like now with the platform, with people knowing us, with our social media, we're going to be able to, get donations, help people, if people are always asking, where should I donate? Where should I help? So, we're working on getting some products actually that we sell that then, like a Newman's Own model where that product, all the profits go into the foundation. And then we go around and do this wildlife rescue work or support the centers that are already doing a really good job.
Hearing these stories, it's incredible. I mean, I hope that you're hearing what I'm hearing as you talk about this, because what you said about feeling the guilt where you can't go back and help every single one of them, but gosh, listen to all the good that you're doing, not only for this dog who had this burn. In full disclosure, was his name Archer? I'm pretty sure I saw that episode.
Yes.
Yes.
Dragon Slayer.
Yes. So I do think I saw that. Well, I know I saw that episode, but not only helping him, but bringing this technique to, so many different animals. Gosh, there's gotta be some emotional challenges like you're talking about of not being able to follow up on some of these cases, but just the amount of good between what you're doing and Nat Geo making the financial side of things possible. I mean, it's incredible.
Well, thank you. That's really nice. But just a reminder, I have editors that work full time to make me look great. So
yeah, me too.
Yeah, actually, Dana, I have to do a shout out to a few people. Dana Kemp is one of our main editors over at Lucky Dog Films who makes the show. And she's been our editor from day one. So, 10 years of watching my kids grow up, of watching me mess up, of beeping out all my cuss words. And then finally I silent beeping them because I was getting a lot of people writing in saying, you got to watch your mouth. My kid knows that you're swearing all the time. And the other person for a shout out is Tracy Corneliuson. And she's been our like office manager and kind of support tech for the last, I think 5 years now. Mm-hmm. And she just makes sure she's the one that's always doing the scheduling, working ahead, changing everything because of, all how it is to move around and the bad weather and emergencies. And so, those front staff people, that means she's our front staff person. And Sierra is too. I mean, she's between myself and Tracy, we've trained Sierra and Maya and Willow, my daughters, to be amazing, vet techs. And yeah, it's been quite the ride. I don't know. Sometimes when we talk about it like this, it's like, dang, this just started out like, do you want to make a couple episodes? And it's like, okay. And now, we've been to all these cool places. I'm so excited. We've, been able to inspire a lot of people who want to be who want to be vets or vets who are out there. I get lots of letters and contact. And then now somehow we went to Australia and then somehow now we're back in Australia. It's just, for Sierra to start her career. So it's, well, not started, I guess, to continue it.
To continue it. Yeah. I think your career started when you were 14.
Yeah. I know. I always say, I remember helping mom pull porcupine quilts. I was going on calls with her pretty much as
40 below. I mean, this poor kid would be the one holding the horse,
Oh my gosh. There was this one case where it was like -40 Celsius, and we were trying to close a wound on a horse's leg, but it was so cold that the blood was like, you know, when you stick your tongue to a pole and it sticks.
Oh my God.
It was like that with all of the metal instruments and the blood. It was sticking to your hands. It was just like, it was,
couldn't wear gloves, like the gloves just cracked. So then I was like barehanded, and we had hot water there. I kept trying to stick my hands in to warm up. It was just unbelievable. I mean, that is the really interesting thing on the show, I think, is that to see how you can adapt veterinary medicine to work outside of a clinic in crazy situations. I mean, sometimes it's cold, sometimes it's, you know, snow blowing sideways. Sometimes it's extreme heat actually where we live, because animals aren't used to the heat and we're getting all the weird extreme weather that everybody else gets. But sometimes it's actually heat, you know, or rain in the middle of winter and ice storms, you know, all those things. And as all of us know, especially, you know, farm vets, those vet calls never stop. In fact, they get more common when the weather does a crazy shift. So, you know, to make a vet clinic work, you know, on the road or out in the field, is a real trick. It's really interesting. And I think that's one of your best skills here, I think, is we always joke that you MacGyver everything, but I think it's because you grew up as a bush kid in the Yukon having, you know, I mean, these kids would go to the dump and get a car hood and pull it behind snow machine as a sled. You know, they would do like the craziest stuff because that's what they had, you know, just, it's
a lot of like being out there, and then it's like, okay, well, we don't have this. What else can we do? It's like, like, I don't even know. It's just like, we have to just make some stuff up as we go, because it's either like that or it doesn't get done. Like, we were trying to figure out how to vaccinate these bears one time, and we didn't know how. We were like, we can't really stick pull them ish because they'll turn around and grab it. And so I ended up getting the blowpipe and attaching some fishing line to a dart, and then we blow dart it and then just reel back in the dart so that they wouldn't eat it.
I love it.
But it's like, it's stuff like that. We're just out in the field, and it's like, okay, you either MacGyver something to get it done or it doesn't get done.
And, you know, I will say, as, you know, nothing like some of the things, I've never been in a position where I had to MacGyver anything to vaccinate a bear. But, you know, as a house call practitioner in, you know, in somewhat a rural area, I actually really appreciate that aspect of the show of, you know, sometimes the situation isn't ideal, but you have to get it done anyway. And, you know, I've tapped a belly on a pool deck and done a blood transfusion on a kitchen floor. I don't know if I should say that out loud on here, but I have. And both of those, well, one of the animals I did, the belly tap, was a quality of life deal, so he didn't make it much longer. But the blood transfusion dog did great, and some of the other weird MacGyver-y stuff, like these dogs have done great, or, you know, animals, cats, whoever they are. And so that's one of the things I really appreciate that you guys, you know, I appreciate seeing that MacGyvering and saying, you know, we don't have every tool imaginable, but we can still get the job done and do a good job.
Yeah. And that's the thing, leaving the clinic and making sure you have every tool with you. Like, it's so hard. And then it's like, we're going to these communities, we have limited space, we have limited weight that we can bring. And then you're looking at everything like, okay, well, do we need this? Can we make something else work? And then it's like, okay, well, like, I remember one day I was sat looking at catheters for like 5 minutes, and I was like, these are 24 gauge catheters. And if something small comes in and we miss one time, then like, if we're working on kittens, so I just grabbed all of them. It was just, it's so hard because you get out there and then you have only what you brought. And if you don't have it, it can really mean like life or death for animals a lot of the time. So it's just making sure that we pack everything that we possibly can.
This makes me think that these are the stress streams you probably have.
These are stress streams. Yeah.
We all have them. Like, it's part of being in the club.
Yeah. I'm like, you forget something once and you never forget it again.
Yes. I actually had that experience this week. I can relate to that very, very closely. Well, so we've talked about the fact that you guys are in Australia. Sierra, congratulations on going to vet school. So excited that you're gonna, be a veterinarian. And I just, with all of the experience you have, your passion, your knowledge, I think you're gonna do amazing things. But let's shift gears a little bit, because part of what you're working on while you're in Australia is a foundation, because like we mentioned before, whenever the show ends, to continue to support wildlife facilities. Is that correct?
Yeah. So there's like I said, I've done a lot of wildlife work in Alaska. I mean, sorry, I've done a lot of wildlife work in Australia.
I say you've also
And
done a lot of wildlife work in Alaska.
yeah. And so, Perth was definitely a spot I wanted to hit anyway. And they have a couple amazing facilities. One is called WA Wildlife, and it's like the best referral wildlife. I mean, it's like the best referral hospital you've ever been in, but it's just for wildlife. It's incredible. Like,
That's amazing.
and there's a lot of really well organized wildlife rehabilitators and wildlife centers across Australia, well, at least in the several places I've been. So that's one stop. We've recently worked in Costa Rica. I've also worked in Sri Lanka a few times, and I'm going to Uganda in the next couple of weeks, and hopefully Madagascar. So there's going to be a lot of international travel to centers that, are doing a great job on very limited either funds or equipment. And so that's what I'm hoping to do, is to go work with these folks, see what they need, and then use funds to, fill in their gaps, and definitely some of them need, my personal help, like with, how can we fix this anesthesia? What can we do? But really most of them know what they're doing quite well, and I'm learning from them. But I do have good experience in, what can help make things run smoother. How can we better support the animal under anesthesia? How can, different equipment that they just couldn't access. So, and now I have a line to, some amazing companies that are willing to donate that stuff. And so it's a little bit of, trying to get everybody well outfitted, helping with any anesthesia protocol development, and also just helping promote them, like show the world this work that's going on at, Toucan Rescue Ranch in Costa Rica and the Sloth Institute. I mean, that place, if you look up Toucan Rescue Ranch, like really look them up. It's just incredible how many animals go through that center. They do tons of sloth work. Sloths get electrocuted on power lines all the time because they're climbing them like trees.
Sure.
And because of that, those electrocutions, they lose their babies sometimes. There's a lot of orphan sloths that are found, and those can be raised and released quite readily, but it takes time. It takes almost a year to raise a baby and release it, or 2 years, sorry. Yeah. And then a lot of the animals that survive electrocution, they have to have arms amputated or they have severe burns. So we work with them on fish skin, but also the amputations. A three-legged sloth can actually be released and raise a baby again and do quite well. It just needs help getting back out to the wild. So they do a ton of that work. And there's a few other places, we've worked around the world now that, they're just beating the bushes trying to get attention and get people to support them. And this work is being done in biodiversity hotspots that, these animals, these individuals are actually really important to the population. Of course, it's about, individual injuries. And, I agree with all of that, and the poor animals, and, that's so important, but they are also super important overall for conservation. And these centers not only work to help the individuals, but they also work with like the government agencies to get at the root of the problem, so for example, Toucan Rescue Ranch is working to put all kinds of things on the power lines to block sloths from getting up there. Yes, there's a lot of work at treating the individual pain and suffering, improving the conservation at the population level, and then actually working to prevent the problem in the first place. So those are the centers that we're really trying to target and support in any way they need.
Man, I could just sit here and listen to all about these different rescues and stuff. It's so interesting. It reminds me of, we have an elephant ranch, I guess is what I will call it, near us. And I took my daughter there on her birthday, and we went and saw the elephants. And she was talking about some of those same situations that they run into. I think she was talking about India and some of the issues they run into with elephants, with hit by cars, and dietary stuff from getting into trash or something. I can't remember exactly, but things that you may not think of on a day in and day out basis, or if you did think about it, you might think about it on that individual level, but really these are big wide spanning problems.
Yeah, I mean, you think it's bad when a dog gets in your trash. Just think about an elephant rummaging around out there.
Can't be a good thing for anyone involved.
Yeah. Yeah. No, and some of these problems I find personally overwhelming. You see things, you see some of the documentaries on TV. It's like, we all get that, like, overload of where you just sort of want to give up and you don't know what to do. But, then you spend time with some of these groups and it's like, no, you don't give up. You go here and you go there and you support the people that are doing it. And so that's what we're trying to do with the foundation. And it's early on, we're just getting going with it, but I have a lot of hope that we're gonna, I not even hope, I know we're gonna do it. I just, there's a lot to figure out along the way here. And we just finished filming 2 seasons back to back. So we're going to have a bit of break now. And that's why I'm, kind of gallivanting around now to try to figure out this foundation, how we're going to do it, how I can put people in touch. And then the one other component that I want to add to the foundation, besides, helping animals and helping the groups that are doing such good work, is to try to pull in everyone that wants to help. I have so many cool vets and vet students and pre-vet students and, people that want to help. And so, we're talking about at the Alaska Wildlife Conservation Center, trying to set up some type of, internship or training. They already do a great internship there, by the way, for people who, like undergraduate students that are interested in wildlife. It's not a vet internship, but more of a general one, but, a way to try to rotate vets around and do vet collaborations and exchanges, because it's really cool. Even if, we're supposed to get some of the Costa Rica vets come work with us in Alaska, and they're not likely to ever work on a moose again after they leave. But it's not really the point. It's, it's seeing all the different species, it's seeing, again, like this talk about how you MacGyver things, how you make the equipment and the concepts work in the field, and not just barely, but how you do it like to a really high standard, like all this equipment's getting more portable. There's oxygen concentrators you can take in the field now if you can't get oxygen tanks, and oxygen support is so important under anesthesia. And, what about pulse oximeters and what, all these things are really so portable now, and you can pop an IV in, and running IV fluids. Gosh, that's just like so important. Like some of these basic things we can do that we don't always do. It's cool to remind everyone and work together on, how that works wonders when you're working in the field, no matter where your field is, whether it's Sri Lanka or Australia or Costa Rica or Alaska.
That's incredible, and such good messaging to get out there of like, we do it great, and now, there's things happening, and we can do it better, and we can all work together so we can all do it better.
Mm-hmm.
Is there any sort of resource now for people who are listening to this podcast and say, that sounds so cool? I'm not talking about myself. Yes, I am. Any sort of resource now where, vets who are listening and they say, I want to be involved, I want to help, I want to know more and help contribute to this. Can they reach out? Is there a website, or is there something they should keep an eye out for?
Well, there will be soon. I think the easiest way is to follow our Instagram and TikTok. It's at Yukon Vet. And that's where we're going to be dumping all of this, like all the different things we're working on. We'll be releasing actual website soon for the foundation. We'll be releasing all of that soon at Yukon Vet. So that's probably the easiest way for me to tell people is to follow that and watch for those things. We'll, we do stories all the time where we are, but we'll do posts that actually make it easy for people to find the work where they can get involved. And yeah, that's all I can think of.
Yeah. Like if they follow like Instagram and stuff like that, then we post enough about there, even at the facilities that we go to, like we'll tag them in it. Like if we did work with with Toucan Rescue Ranch, with the Sloth Institute and stuff. And you can find all their information on our posts.
Yes. And they take a lot of visiting vets, they're these places, sure, jump in, if you can go. And I encourage a lot of vets to consider doing that. And I think a lot do, but there are these good groups like, I think it's organized out of Australia. There's Vets Beyond Borders. There's, I think there's even a Vets Without Borders, like Vets Sans Frontiers. There's like 2 different organizations with real similar names, but also just reaching out to the centers, planning your some of your vacation time. Maybe that doesn't sound real healthy to everyone, but I love that is when I travel is to go.
Awesome.
Fine. Like I just went to Baja for a few weeks for vacation and air bunnies. And before I went, I'm like, well, I'm going to check out. And there's this in Mulahay, which is a great town in Baja. You got to check out. There's a spay neuter clinic. They're phenomenal, run by like an anesthesiologist from Washington, a bunch of vets, and they just like rotate vets through, so just like sign up. And if you can come in a month, we'll put your name down and you can do a ton of spay neuters for a couple of days. And then, you're right there on the beach. And so there's a lot of work we can all do like that in places that can't afford to have vets paid at least, or have clinics or things like that.
That's good to know that we can go and do things like that. It's definitely not something that I have a lot of familiarity with, to know that there are centers and we can just reach out to them as vets and say, hey, do you want some help? Is there, I'm getting probably a little bit too nitty gritty here. Like, is there special licensing and stuff that that you have to work in all these?
Yeah, I mean, for sure. And those centers will usually have it worked out. So often either you're just supporting, most of them already have a vet staff or vets that come in, but those vets need help. So, you can be more of an observer or supporter or work kind of, more as a tech kind of a thing. Or if you're going for a longer period of time, they can help you, put you in touch with the licensing group. But for most of I have gotten licenses, for example, in Australia, when we definitely were licensed. But in other places, if I'm just there for 3 or 4 days, either the licensing in these places was almost non-existent, or I was working under the supervision of a vet that was right there who was licensed. So, it's you certainly, that is something that you should pay attention to no matter where you're going, of course. But most of these places have it figured out already because they're used to vets coming and helping.
Very cool. Very cool. And I'm thinking about you doing all of this without your right hand technician, because now she's gonna go be a vet.
Cassie, don't make me cry.
I'm sorry. I know I would. Oh my goodness.
Yeah, like I'm kind of wrapping up and leaving in a few days, and it's gonna be hard. I don't even know.
It's the real problem is gonna be getting Maya and Willow to take my spot. We were trying to work out who's going to take my position when I leave, and neither one of them want to.
No thanks.
Yeah. And I was like, because I don't just do like a lot of the fun stuff that you see like on camera where I get to be like holding the animals and watching them recover and stuff like that. I do a lot of like the background paperwork and setting up and packing and cleaning instruments and stuff, and just like setting up, takedown. And Maya and Willow don't want any part of that.
Yeah.
Sure. They're like, we'll hold the animals. Tough. I mean, I can relate to that.
I think we're gonna have to just wait to do everything on her like summer vacation kind of thing.
Just we're not doing anything until school lets out, and then we will practice again. Well, Sierra, are you gonna go back to the Yukon and be the next Yukon vet? What do you want to do after school?
Yeah, I'm coming for my mom's spot. I'm actually
she's gunning for you.
But I'm not really sure what I'm going to do. I mean, I'm just going into my first year of the program. Well, it's a 5-year program actually, and I'm going into the second year of the program. But I'm not really sure what I want to do. I know I love working with wildlife, and I love working with all of these different like rescue centers and stuff. It's one of my favorite things to do is just to go to these clinics and then just to see how it's run, and then just take ideas from that to other places that we go to help improve, and then also help other clinics to improve. Be like, hey, have you tried this? Have you done this? And just even like the setup and takedown I really like. But I think that with the show, it kind of set me up for a little bit of failure in the department of I don't really think I can stay in one spot for very long.
Sure.
I mean, I love the travel. That was part of the reason I love my job is I love the travel. I love the people that I work with. And I mean, it's so fun just to be working with different people like all the time. I love people. People always say that I'm going into veterinary medicine because I don't like people. I'm like, well, that you're in the wrong profession.
Gosh. Yeah. It's such a people business. If you're going into
veterinary medicine, you need to love people and love all the quirks and all the funny stuff that come with it. Even with wildlife, because even though there's no owners there, you still have to deal with a lot of people who are help manage the wildlife. But yeah, I mean, I'm just kind of seeing where it takes me right now.
Yeah, keep your mind open.
Mm-hmm.
Yeah, that is the way to go into it, and just kind of find, I don't know, things tend to find us and say, this is where you're supposed to be, and you've just got so many skills in terms of logistics and the medicine itself, and all these different experiences that I know whatever you do, it's going to be great.
Thank you.
So one thing I've always wondered whenever I've watched the show is referral options. So we've talked a little bit about sometimes you just got to get it done, and with whatever resources you have at hand. But if you have one of those where you are wondering, how am I going to get this done, even with Sierra's brilliant MacGyvering, do you have referral options available?
Yeah, there really aren't referral options for most of the places that I work. All of the Southeast Alaska and the Yukon, there's no referral. I mean, if you had a colicking horse and you wanted to get it to an equine center, it would be like a 24-hour horse trailer ride. And, and it is even if you could afford and do that and drive 24 hours straight, I mean, first of all, is a horse going to make it? And second of all, the weather can be so awful. I mean, so they just rarely exist. Now there is an exception to that. When I'm working at the Wildlife Center, and some of the more places close to Anchorage, there's a couple new referral centers. Like at least there's a cardiologist and there's an ophthalmologist. So, but most of the communities where I'm working, that is, a lifetime away. There's, I could barely get there to treat their animal. There's no way they're going to get their animal all the way over to these places for referrals. So that is, challenging personally, because, I don't, it's the whole do no harm. I want to help. It means that I'm constantly reaching out to colleagues to try to do the best, for every single patient, and it's really exhausting to do that on one hand, but I feel like you have to. It's so hard to know and remember everything. And, like even just basic surgery skills, like, I hadn't done a C-section in 5 years. And then I had an emergency C-section on a 2-pound Yorkie in the middle of the night on camera. There was no way to get her, she was supposed to leave on the ferry the next morning at 11 o'clock and it was a snowstorm. Like there was just no way that she'd get on a flight, and the ferry ended up being canceled. So I ended up doing the C-section, and I hadn't done a C-section in years. And most vets are used to doing C-sections all the time. No big deal, right? But when you haven't done it in a while, like quite a while, and you're doing it on camera, it was just like, and the thing is so tiny. Yeah. And I mean, spoiler alert, it turned out okay. And, it's on the show, but I feel like I get a lot of procedures like that, like where either I haven't done it in years or I have never done that procedure and it's being filmed. And that's just so challenging because, first of all, I know all the vets who have done it, who do it regularly. Of course, they're probably going to be the ones watching. I mean, that's what it's telling me in my head, that nasty little voice. And it's like, shut up.
No one wants to do a C-section on a 2-pound Yorkie. Let me assure you, we're all feeling your pain at that point.
Yeah. So, I mean, but there's just different procedures, where I haven't done it and I'm in there doing it. And they're asking me questions like I'm the expert on how's it going. And I'm like,
there was one I was watching and I remember it was like a potential GDV. And I was watching and I was like, if that's a GDV, I was like, is she going to cut that GDV? Like, what's going to happen here? And the dog ended up being non-surgical, but I remember that going through my head where I was like, is she about to cut a GDV? Because as much as God love our colleagues who are like, it's no big deal. Yes, I'm like, I don't want to do it though.
Yeah, that was a friend of ours. I know that exact case. And yes, because and I would have to, right? I don't. What am I going to do? Watch the thing pop? There's no, I would have to cut a GDV maybe I did a GDV 15 years ago. Honestly, it just hasn't come up. I don't know why. I know it's common in practice, but it seems like I've been lucky enough to miss them or medically manage them or, you know what I mean? Somehow they've passed me by, and I seem to, I've done a few splenectomies and a ton of eye removal. There's so many eyeball enucleations. Those are so easy though, thank goodness. But
I mean, even the range of animals you do it on, you do it from alpacas to tiny kittens,
right?
To muskox, to horses. There's just, you do a procedure, but it's not just on dogs and cats. You have to go between species of all sizes. So that's really tough too.
Yeah, it is. But the referral option is a thing I could only dream of referring. I wish that was my world, so often. And not just because there's a camera there watching me do it for the first moment, that's
for sure,
of course, really intimidating and really difficult. But because I want to do a good job, I want to help the animal, and it's just you would be so much better in someone else's hands, but that's just not in the cards for where we are and everything. So you do the best you can. And, that always involves for me a really quick prep, so thank God for textbooks and thank God for colleagues that I can reach out to and just be like, hey, this is what I've got. I have a few colleagues that I've worked with extensively at different zoos. Dr. Doug Whiteside at Calgary Zoo, phenomenal vet. He, between him and Dr. Sandy Black, and they were the ones who really gave me my start at Calgary Zoo, as an extern in 4th year. And then I came back as an intern, and then I went back as an associate vet on and off. So those are people I reach out to a lot for the wildlife work. And Dr. Amy Doyle, who's an equine specialist at Atlantic Vet College, we're classmates. and she ended up becoming an equine specialist. And I mean, I call her about probably the simplest things for her, but there are also things she knows that she'd be like, okay, you need to refer that, to an actual equine specialist.
Sure.
But she's come out and worked with me and even brought students out to know that that's not our reality. And if we don't do it, no one's going to. So she talks me through a lot of things that, wouldn't be okay to do, as a mixed practice vet elsewhere. And that is a tough ethical call. At what point do you do something for the animal to give it a chance in air bunnies? And at what point do you euthanize it because that chance is going to lead to more suffering? It's a very, very difficult thing to decide. And so, but it's always in my mind, the do no harm is always there. But I've seen so many animals really fight for life and do well that if I'm going to be around to help with pain control and to help with, ending suffering, if it doesn't work out, I tend to give them more of a chance, and put some blind faith in my own skills especially if I have someone who can mentor me through it a bit.
Sure. And, I'm thinking about it. I certainly hear what you're saying to yourself, that self-talk of like, if there's people who do this all the time and I'm sitting here freaking out. But honestly, I think a lot of us know that reality in practice because, plenty of people just won't refer, even if there is the option. And so walking that fine line. And so I don't think anybody is watching this and going like, oh, I don't understand why this would be stressful. I do this all the time. I think, vets out there watching are going, yeah, I've been there. I would want to refer that too and have not been able to. And she's sitting here doing it on camera for the world to see. Yeah. So I certainly think you have all of our respect going like, oh, like that looks really hard.
Yeah. And I think a lot of, I say, oh, well, you guys all have referral centers. I think the reality for most vets also is that owners can't afford referral centers no matter where you are. So you do end up doing a lot of things and with the referral center down the street because the owner won't do it and you want to try to help, but it's a tough thing for a vet in any situation, to feel like less than the best choice. And I think, honestly, that's something that I hope to see change. Referral centers are wonderful, but we can do a lot as vets in general surgery. And, I hope people really trust themselves and push themselves a bit to develop, especially within a practice. Sometimes you'll have multiple vets and some are really good at ultrasound and some are really good at surgery, to sort of like, as young grads, and stuff, I think you should really push yourself a bit to get better at different techniques and not lean on the referrals so hard because you will come to those cases that they just can't afford it and you still want to do a good job and you want to help.
I think that's really good advice where, to kind of push ourselves a little bit. And, that's a whole nother podcast episode. I have a soapbox and everything for that one, but I'll stay off of it. But yeah, I think, just constantly pushing ourselves in our skills and what we can do and what we're comfortable doing, because you're right. Like we do have a lot of skills and there's a lot that we can do and a lot that we can do well. I'm the poster child for staying away from abdominal surgeries. I don't like them. And I just, if I never cut another abdomen again, it won't be too soon. It'll be too soon. But, it's certainly true that to have that comfort level, because, sometimes you end up in that situation where, you're the only one who can intervene at that point.
Yeah, for sure.
You mentioned ethics, and that was actually a topic I'd love to cover is, do you ever run into situations where maybe you feel like we should really turn the camera off for this one, or, even something where you get really emotional and you're like, I don't really want to be on film because I know I'm going to have to put this dog down. How do you handle those tough situations?
All the time. I mean, that is the hard part about filming a vet show for everyone. It's like, a lot of the owners are coming to us really upset. Their animal, just picture if it's your own dog that just got hit by a car and you're coming in and people are like hooking a mic on you and like, okay, if we film, it's so hard. Like, I hate to even ask the question. Now, in most of the places we go, people know ahead of time, they already know me, they know the place, but we're going to communities where they know the deal. And, you can logically explain it to someone like, if the filming is what's paying for getting us here, like and sharing your story is really important. It helps so many people who go through this. I get so many messages and letters from people who saw us go through a case and were like, gosh, it helped to see someone else going through that and to see that, I know the animal didn't make it, but, to see them go through that pain, it really helped me with mine. And so, that's a tough one all the time. Every single day we have issues like that. And, people don't want to be on camera sometimes, and that's okay. But we still have to be their vet. We still have to do that work because we're the only ones there. And so that makes it really hard for us, so we try to tactfully schedule, get the filming cases while we've got the crew. If it's not an emergency, obviously emergencies take precedence, but, and then move the other non-film cases to a different time slot where we're not filming. And, that really makes some people angry, but it's kind of like, that's what's getting me around here, so it's a tough one for us to manage, no doubt about it. But most people do understand and appreciate just that we're able to get to the community. And then I think when they see the show come out, I think they really get it, like how everyone feels for them and sees the story and learns about, how this happened in the first place, or, how to prevent it in your own animal. I mean, there's definitely a huge education factor on every case we do. People appreciate seeing that. But, there's cases where, it's an old dog and it ends up being euthanized, and we don't ever film euthanasias. And it's just like, that's just how it is, and we've all been there. I mean, our own goat, my daughter Willow's goat, it's hard to talk about to this day. Aww. But a dog attacked it, and she was pregnant, and Willow, the goat was getting ready to have a baby. And then Willow came home and found, everyone was standing around her goat, and she's like, oh, she's having her baby. And then ran up to it and found this white goat covered in blood, and ripped apart. And I was at a clinic about an hour and a half away. And so they were bringing me in. I had to meet them and get the goat, and her name's Kate. And so then I had to, put Kate, try to save Kate's life. And it did not work out. And,
well, you kind of had the cards stacked against you there because the power kept going out. It was just like,
that was an incredible day.
Yeah.
The power was going out. We were having a storm, so the power was going out in the middle of surgery, and her heart stopped twice. We got it back going. Like, it was just, we almost did it, almost pulled it off.
Oh, sometimes those are even harder.
We've had quite a few. I mean, even this past year, Daisy, our pug.
We lost our pug away this year. Dang.
And it was all on camera. And I mean, it definitely is hard because we go in there and it's hard to have a camera in your face when you're upset, when you're concentrating, when you're doing something you've never done before, or when you're emotional and you have like something's wrong with your animal. Like, I mean, Frankie was bit on the head, and I was filmed, and I was like, it's a good perspective change to see how people are feeling in their shoes, and just to be a little bit more empathetic towards them when they're coming in. But we had our pug pass away on camera, but it was like, you looked around and you saw that the people who were filming, the film crew, like, they're in it with you.
They're crying.
They're crying, like they're behind the camera, and there's tears running down their face too. Like, they're
a very emotional, as we all know, it's an emotional job, and it's emotional for the crew. Like, they're invested, and they love animals, and they get to know the people. And so that, I don't have a clear answer on the ethics of all of that. Like, it's a daily battle, and there aren't easy answers on it. But I do feel like in the end, we're sensitive about it. We're trying to get around and do good and share stories that are tough for people to go through. But everyone so appreciates when they do, even us. And, you can tell I'm still emotional about Kate. I can barely talk about that stupid goat. But, it was like 10 years ago. And it's like, but I know how people feel, and then they filmed that whole story, and it came out, and so many people reached out and were like, they'd lost an animal like that, and it meant so much. And, especially when it's your kid's pet that they have their whole heart, resting on. So it's just, we know how it is, both from the owner side of it, or the, the family side of it, and the vet side of it.
And there's even, there's been like so much good that's come from the show, and even the specific case where there was this, older guy who lived out on his own, and he had this dog, and this dog was his best friend, his protection, like everything. This dog was to him.
During COVID too.
And it was during COVID. And I mean, we went out there and the dog ended up being riddled with cancer and we had to euthanize the dog. But after that show came out, a Labrador breeder from down south saw it and he flew up a dog for him. He flew up a new puppy for him.
Oh my
gosh. He was like, you
So
need this dog. And I was like, honestly, just for that alone, it just kind of, you look at stuff like that, it makes it really worth it.
Oh, wow. Oh my goodness. It's like, gosh. Okay, that's really emotional and really, really heavy. And I so appreciate you guys walking through all of that with me. I can't imagine some of the challenging situations, but, you know, I'm sure, you know, as veterinary professionals listening to this podcast, you know, we know that your hearts are in it. And then to know like the crew is in it with you too, and everybody's so invested, you know, as hard as these situations are, I really think you guys do a great job of bringing that story to light.
Thank you.
Okay, so let's talk about something a little more fun. Something I'm dying to know. I have 2 daughters, and actually right before I got on this recording, one of them was helping me with holding a dog so I could put an IV catheter in him and he could get IV antibiotics. But you know, I watched just the relationship that all of you have, and you know, how do you foster that relationship? And obviously there's editing on the show. I'm sure life is not always perfect behind the scenes and all of this, but to watch the relationship between you and your daughters, you know, now you have Sierra who wants to be a vet and nobody seems resentful or upset about the time that they spend in the clinic and working with you. How did you pull that off?
Yeah, it's exactly like that. We get along so well.
Mm-hmm.
No,
it's a family business. If there's always gonna be fights, like there's gonna be, and I mean, especially with like emergencies coming in. Gosh, I mean, this past summer, Maya and I couldn't go out one weekend without being called in on an emergency. Like it would be like we would be 7 o'clock. It would be just getting ready to go to like my friend's place and have some drinks, and we would get a call being like, you got to come in. And we would be like,
you guys would look so nice when you came
and
in.
We would be like, totally dressed up in our going out clothes. And we would just throw on a scrub shirt and we'd be there and we'd have to. And I mean, like,
I'm still blown away by all the times that you guys just showed up. I have to admit, like, I don't think they realized they had the option to not, because so many times I'd be like, oh God, you know, can you guys just come help me hold something? Can you come over? We got this emergency. And you know, they'd be like, oh my gosh, we're just getting ready to go. And, you know, and all that. And they would still show up. Like, but I guess, you know, having worked it together, we all know what it's like when it's just one of us or just, you know, we all know what it's like when we're not, you know, when you need a hand and someone's not there. And also in a small town, you know, most of the people. And so then it's so sad when, you know, it's like, oh, guess what? It's this person, you know, you're going to see that person again. You know that a lot of people's whole life story, you know, that animal. So, I mean, that makes it a lot, you know, more personal and easy to, you know, get motivated to come in for sure. But yeah, I mean, it's started out with me and 3 kids. And then, you know, now we're 4 women working together and geez, of course, you know, one of us gets our time and then it passes through and all 4 of us are cycling together and oh man, and
then it's really a problem.
No, but it's, I mean, it's tricky because everyone has what they're good at. And unfortunately for Sierra, she's kind of good at everything and all the jobs, even the ones that aren't fun. And Maya has never said she wanted to be a vet, but she's very willing to help and work, and not just to be on the show. She likes the filming, but she also loves the animals, and she's really good at, you know, recovering, but that's a fun job. Who doesn't want to sit, you know, cuddle the animals after recovery?
Oh yeah.
You know, and Sierra's like, could I do a little bit of that instead of doing like the cleanup and blah, blah, you know? So I often get pulled in the middle of like, you know, really, you know, and, you know, Sierra's trying to teach Maya how to stain slides. And
Maya lit it on fire.
Yeah, Maya dips it.
Oh no, she alcoholed it first.
Yeah.
Oh no.
And then lights it, and it's like, you know, the slide's on fire, you know. And she's like, "Well, see," and there's Sierra's like, she's just doing that so she won't have to do the slides.
Yeah, like, gosh. I mean, I have been trying to teach her how to wrap packs for 10 years, and she still does not know. Mom, don't laugh. You're no better.
I have other things I need to be doing.
Yeah. So it's like, okay, well, I'm leaving now, and I've had like 10 years to try and teach you guys how to wrap packs. And now it's like, you guys are going to need to YouTube it, because like, I mean, Maya's like, well, I just don't know how to do it. I'm like, it's not hard. I've sat down with you probably like many times showing you how to do it, and you just choose not to learn, and then you don't have to do it.
Yeah. So I guess you can hear that it's not all rosy, but
it's not always perfect.
And Willow just kind of rejoined us. Willow is just graduated high school. So she's, 7 years younger than Sierra, 5 years than mine. So through a lot of the bulk, like she filmed the first few seasons, and then kind of through her middle teenage years, she just didn't enjoy it at all. And, friends were teasing her. She also felt like she just wanted to be traveling around with her, like her volleyball team, or she didn't want to travel at all, was a big thing for her. She's like, I don't want to travel. I want to stay home. And, so that was understandable, of course. So she didn't film for the middle bulk of the season. And she just rejoined us last year, this past year, where we did 2 seasons. And that was tricky to kind of work her back into it and get her feeling like she was, knew how to do things. And, and she's a teenager. And so, we'd be showing her stuff, and she's like, like typical teenage things. Like I don't think I fired you, but I definitely fired.
You fired me.
Oh, did I? Well, I fired Will, and I fired Maya multiple times, and
they just keep coming back.
And can you imagine how family dinners are after you've just been fired, and then you have to sit down together?
You're fired. Yeah.
I mean, to be fair, I probably deserved it each time. I would have fired me too, but character grows.
I don't know. You're fired, but also I really need your help.
Yeah. And I don't know why they keep coming back. I think well, I mean, we love each other. We fight for each other, and it's a small town. They don't have a lot of other options.
There you go. Yeah. It's like, yeah, I love it. It's so like, it brings it so full circle. 'Cause I watch and I'm like, they are just like totally fine with going to the clinic and working. I was like, I hope my kids are that all right with it. And they'll help me out like that.
Of the reality TV that might not be as
real.
As real. But I mean, to be fair, I think that we do get along a lot better than the average. I mean, even with Maya and I, like the average sisters, like I think Maya and I even lived together for like 2 years, and and just to hear people be like, I could never live with my sibling, and Maya and I would work together, go back, and then have an apartment together.
Different. It's so funny.
Yeah, we are very different. Yeah. And so it was.
And sometimes when it's be frustrating because I'm out filming and doing stuff, and they're like waiting in the car at some crappy weather, and they didn't need to be in the scene or whatever the thing is. And I hear like hysterical laughter, and they're like giggle festing in the truck. Showing each other videos, falling all over laughing, and I'm like out there working, and I'm like, really, but
you're like, my fingers are falling off from the cold, and you guys are just having a giggle fest in the truck. Oh my goodness. Well, this has been probably one of the most fun interviews I think I've ever done. I mean, it brings the show so full circle. I mean, you guys are so dynamic with all of the things that you're trying to do, and these passion projects, and the incredible care that you're able to bring to these places. I can't thank you enough for coming on the show.
Oh, no problem.
Thank you for having us.
Yeah, thanks for the interest. It's exciting. It's really fun to hear from vets who like the show. That means a lot, because it's always, it shuts that little voice up a little bit more that says I'm not doing things right or whatever. So
you're doing a great job.
Thank you.
Again, so much fun. Thank you. Everybody listening, check out the Instagram at Yukon Vet if you want to learn more about the foundation and all of the exciting things that are going to happen there. And if you haven't watched the show, I'm sure you can hear the excitement in my voice. You should.
Yeah. Oh, one more quick thing is that the show, the new seasons, they air, I believe it's April 8th. The new season 11 starts on Nat Geo Wild every Saturday. And then on April 12th, I believe it is, the whole season dumps on Disney Plus. So right now, all previous 10 seasons are on Disney Plus. You can live stream them. And then, like I said, this new season will be on there as well. And then there's another season coming right away, but that'll be in the fall sometime.
Perfect. I will tell you, if you and your daughter both have strep throat and you need to pass the day, it'll suck you in.
Yeah.
All right, guys. Well, I'll let you get back to your weekend. Again, thank you. Thank you so much.
Thanks, Cassie.
amazing. This was so much fun. And Michelle and Sierra, thank you for being so gracious and so generous with your time and making this work on a crazy tight schedule. I also want to give a huge shout out to Julianne Robinson and Lacey Smith here at VetFolio for giving up their evenings in order to make this happen. I had a blast and may even make an Instagram account as a result to follow the happenings with this new foundation. For more episodes like this, click on the Education tab on the VetFolio website. As always, we'd love to hear your input on this talk, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassi DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.